I'm going to allow, we have both Jennifer Dixon with the Department of Health on and Kelly Charvet with CHAS Health, because this week is still a combined effort on the scheduling process. So I will start with Kelly and she can talk to you about what's happening with those appointments that need to reschedule due to weather.
Good afternoon, everybody. So as Kelly stated, those individuals who were scheduled at the Spokane Arena vaccination location for Friday and for Saturday will need to be rescheduled due to weather delays that have impacted our shipments of vaccine. And what will happen is those individuals affected will receive an email and or text, depending on what kind of contact information we have for them this afternoon. And they'll be given a new date and time window to come in next week to get their COVID-19 vaccine. So that information will be going out shortly and will provide those individuals with the instructions on when they should be coming down to the Spokane Arena next week. I'll turn it over to Jennifer to talk about the rescheduling of Sunday and Monday appointments.
Okay, yeah, thank you, Kelly. So we had already planned prior to this weather delay in the shipment to reschedule people who had Sunday and Monday appointments so we could move forward with a Tuesday through Saturday schedule at the arena. So that'll be our schedule moving forward. Like I said, we already had it in the works and in the plan to call people to reschedule those 2 days and get them into the following week. Just so happens that this week there was the weather delay and now we're rescheduling Friday and Saturday appointments as well. So 2 different things going on, but we're trying to handle them in the most efficient way possible, trying to make it as least confusing as possible for people and still making sure all those appointments are honored.
Thank you, Jennifer. So that information combined with the notice that we sent you, are there questions that you all have?
This is Ariel with the spokesman. I just wanted to clarify, were people vaccinated today at the Spokane Arena site, or are all 4,000 of those first dose appointments going to need to be rescheduled?
We did move forward with vaccinating those that were scheduled for Thursday because we did have some overflow vaccines available from a previous shipment that allowed for us to provide those vaccines to individuals today.
Do you have numbers on how many people will get vaccinated today then versus needing to reschedule?
Don't have that at my fingertips, but I can try to get that to you.
Thank you.
This is Alex from KXOY. Where exactly are the shipments of the vaccines coming from? And do you have any kind of timetable as to when they could begin to be shipped out to the area?
Yeah, so we're getting the Moderna vaccine at this site, and it's coming from the Midwest area, so Mississippi specifically. And I don't have that information until we have tracking numbers saying, hey, your vaccine's been loaded up and shipped out, ready to go. And we don't really have a way to anticipate when it will arrive.
Is there any worry of terms of a backlog with the appointments from this week going into next week here, or is there going to be everything will get back to normal in 2 weeks' time?
Yeah, I don't think we have that concern at this time. We're trying to get everybody scheduled into 2 weeks. Next week will just be a busy week, trying to pull in some extra staff so we have that extra support, but we're pretty confident that we can get them all done, make it all happen, and then moving forward, we'll just go week by week like usual.
And Ariel, to get back to your previous question, it looks like we are vaccinating approximately 1,200 people at the arena location today.
Thank you. Are the folks being rescheduled from Friday and Saturday being rescheduled later in the week next week to ensure that those Moderna doses actually get there?
Yeah, so the plan is to spread out those who are being rescheduled between Tuesday, Wednesday, Thursday, Friday, and Saturday, so that we don't have any one day that is a particularly overwhelming day for providing those vaccinations.
This is Alex with KHQ. So the plan is to to vaccinate the remaining, few thousand people next week and open up another 4,000 appointments for next week. Did I understand that correctly?
Yes, so we're not actually opening another 4,000 appointments. Next week was meant to be just second dose appointments, which our CHAS partners have done a great job at pre-scheduling all of those appointments. So we already have those appointments accounted for. So those appointments will be happening next week. The plan was to only have those appointments next week, but now we're adding in all of the people from this week that need to be rescheduled.
That's right. Okay, gotcha.
This is Ariel from the spokesman one more time, sorry. Is there any concern right now that we won't have doses by next Tuesday, or are we getting signs from the federal government that shipments should be moving to have us on target and ready to go by Tuesday?
Yeah, I don't have any direct information. I mean, we're hopeful, we're optimistic. We haven't heard anything that tells us otherwise, that it should be even later, but we don't have anything confirming the opposite either. So at this point, we're just moving forward with receiving vaccine on Monday, as we typically would anticipate receiving it, and we'll just have to go from there and make decisions if that changes.
This is Alex from KXY again. Is there any concern with people's timeline with getting that Moderna vaccine, in terms of there is that certain time period in order to get that one, where it might go to a week later than is recommended?
Yeah, so for Moderna, the recommended timeframe is that 28 days. The CDC has guidance out that that second dose can go out if you are not able to get your second dose at that 28-day timeframe, that you can go out to 42 days. So they have guidance out regarding that. And so that's what we're going off of, and we're confident we can get everybody in prior to that timeframe being an issue.
Are there any other questions? I know I have KREM on here. Rebecca, do you have any questions? Oh, she was the same time I said her name.
I do have a question. So I guess my question was, I noticed in the email there was some instructions about, if you get a call asking for different information, probably is not the health district. Is there concern that there might be some people that there might be some challenges with rescheduling those appointments, that some people might mistake the calls or just not get back in to get their second dose?
So I know we put out messaging this morning. All three of us, DOH, CHAS, and SRHD, have all worked together to develop messaging to get to our hotline. So the COVID hotline that falls under DOH. So those callers, people taking calls, know and understand what we are doing, what we are asking for. And then we've also, there was a press release put out by CHAS or SRHD, sorry, I don't remember, that explains, what it is that we are doing, what we are asking for, and how that process should look. So what to look for as being okay and legitimate, and what to look for as a red flag and something that might not be legitimate. So we've done some work on putting messaging out to make sure people understand. And Kelly, I'll let you add more.
Basically, if someone receives a phone call and they're asking for information other than date of birth just to confirm their identity, and then their contact information just to make sure that they're sending rescheduled information to the proper place. If they're asking for further identifiable or financial information, then that's where a red flag should come up, and they should not provide any other information to someone over the phone. And then if they are concerned or they just want to be safe, then they can call that 1-800 hotline number of DOH's and confirm that it's a legitimate call, and they can even give them a number at that point to call back and continue the rescheduling process.
Thank you.
I have one more question. It's about the 1,200 doses that you had like an overflow for that shipment. When did that happen? How long have you guys been like, I don't want to say holding on to them, but when did you get that influx, 1,200 extra doses? That's a lot of extra doses.
That has occurred over the course of the last week. So week to week, obviously we are scheduling. We've had to schedule as many patients as possible based on the allotment that we've had available. Now, day to day, there will tend to be people who don't show up for their time slot or what have you. I mean, those occasions just occur. And so we also have wanted to ensure that we don't run into another situation, which had previously happened with I think it was week 2, where we had a delay in our shipment becoming available. And so we did at that time make an adjustment to make sure that we had some buffer in there in case we ran into that situation again, to ensure we didn't have to reschedule a whole ton of patients once more. And so that's where that came from.
Thank you. So when these 4,000 do come, basically the doses you had to give out today will go into that overflow pile just in case there's another buffer. Is that right?
That will just kind of continue. We aim to get out as many vaccines as possible every single day, and that will continue even as Department of Health takes over operations. It's always a fine balance of making sure that we have the appropriate number of patients scheduled, and also allowing some safeguards to make sure we don't run into issues in the future.
Okay. Any other questions? KREM, are you good? Okay. All right. Thank you all for joining us this afternoon. I know that it's with the multiple reasons of rescheduling, and that it could become a confusing topic, but I thank you all for joining us to make sure that it's clearly communicated out there, and hope that we've been able to answer your questions fully. You'll be hearing from us soon, I'm sure. Thank you.